Kate McLaughlin. I am a freshman for spring semester 2025. I don't have my badge, but I'll include it in the comments. Good afternoon, Mrs. Jones. My name is Kate. I'm a Maria College nursing student. Before I begin, may I just get you to confirm your full name and date of birth for me? Alright, that's correct. Mrs. Jones has given me her full name and date of birth, and it matches her wristband. And Mrs. Jones, do you have any allergies? Mrs. Jones states she has no allergies. And Mrs. Jones, are you in any pain today? Mrs. Jones is in no pain today. Mrs. Jones, I'm coming in because we have an order for a Foley catheter to be placed. So the catheter is just going to go into your urethra, into your bladder, and then it's going to continuously drain your bladder. So while I'm getting my supplies set up, you can just relax, and then I'll come back over and we'll get you started, okay? So Mrs. Jones, I just have to reposition you. You're going to be a little bit exposed, but I've got the curtain drawn and no one should interrupt us. So I need to pull your sheet down. And you're going to feel me, I'm just going to butterfly your legs a little bit just so that it makes it easier when we insert the catheter, okay? All right, so I've got you a little bit exposed. But you still doing all right? Okay. Mrs. Jones says she's all right. Okay. So. Let's see. All right, Miss Jones, I'm going to place a little bit of a paper down underneath you so that if we have a little bit of spillage, it's not going to get wet on you or on your sheets. And then also to a drape on top of you just to kind of keep you a little bit more covered. And then it's just going to expose your urethra for me, okay? Okay. Beautiful. Mrs. Jones, this is a sterile procedure, and prior to doing this, you know, we did your perineal care, so just decreases the risk of infection since it is going right into your bladder, okay? So I'm gonna place my catheter down below. Same thing, place this down below. Make it easy for us. I'm gonna put my catheter into the lube so it's set for us. Beautiful. Throw that out for us. All right. So Mrs. Jones, you're gonna feel my hands spread your labia, and you're gonna feel kind of a cool swipe of me just kind of the iodine, okay? So you're gonna feel me spread and then swipe the first one. Swipe the second one. And then now swipe the third one. Okay. So I've got your catheter with the loop. All I ask for you to do now for me, which will make it more comfortable for you, is you just need to bear down while I insert, okay? So bear down and then I'm inserting, okay? All right. Okay. So I've inserted the catheter up, and I have seen urine, so I've inserted it the 2 inches more. So then now I'm going to now inject, fill up my balloon. You doing okay, Mrs. Jones? Okay. So, filled up my balloon, and it seems to be in. All right. So, I'm going to take my stuff out of the way. I can now put this off put this here, rip this down. I'm gonna pull this off. We are all set. Place this here. Pull this out. And then let me unwind this. Got this going. This. I'm going to take off my gloves quickly. Miss Jones, you did great. Let me get you covered back up, and then we'll be set for the day. So you've got this Foley catheter in, so we don't have to get you up for the bathroom. It you shouldn't have any urge to use the restroom. If you do, just let me know. It might be something's kinked, and we'll just have to get you sorted out. But other than that, you're set. I'm gonna put your legs back into the position they were before. Keep you covered. And then I'm gonna put the catheter bag on the side of the bed on a non-movable portion for safety. And then I'm going to check the output. And we're all set. All right, Mrs. Jones, if you need anything, you've got your call bell within reach, and I'll be back to check on you, okay? All right, great.